Hello, this is Bruce Murphy, Director of Health for the town of Yarmouth, with a coronavirus pandemic update. Since the start of the pandemic virus on March 11th, there has been 330 positive cases within town. Currently, there are 96 active cases. There has been 231 recovered cases and 3 deaths. You can see on the chart that we have right here, the positive cases that has been tracked by the health department from March 11th. You can see at the very beginning is in red, and then green is the recovered cases. So in March, April, May, you can see the beginning of the positive cases. Then it slowed down during June, July, and August. As a matter of fact, during July and August, we went 21 days without a positive case. Now you're starting to see, as the fall comes right now, people are inside. Since October, we're seeing an increase in number of cases. This is the current surge that we have, as you can see on the chart, that is starting to go up right up now in November to December. It's increasing, as we would say, a surge. The other chart that we have right now is the COVID-19 cases by day. So you can see each day how many cases are coming in. So you can see at the very beginning, there was approximately 3, 4, 5 cases per day. And then it leveled off, as I said, during the summer. Now you see in October on the chart that it's increasing, where we're getting double-digit positive cases. In matter of fact, that we also have on Tuesday of this week, December 1st, we had 17 positive cases. So the first part of March, when the pandemic first started, to approximately the 1st of June, there was approximately 119 positive cases. For the month of November that we just completed, we had 141 cases over a 30-day period. So you can see the new surge is in fact here, and people need to take precautions. As I mentioned, that we'll see on this next page right here, the number of positives was 330, with the active is 96. That is spread throughout the town, different villages, as we can see at West Yarmouth with 141 cases, South Yarmouth 122 cases, Yarmouth Port 67 cases. So this is called community spread. There is no current cluster in a business, a nursing home, a work area. It's spread throughout the whole community, which is the important. What we need to stress is that everyone needs to take precautions. We can also see how this is broken down by age group. This is the number of positive cases that equals the 330 that we've had since the beginning in March. The age group between 20 to 40 is now the highest group that we have at 52 and 55. Before, the number of cases was higher in the higher ages between 50 to 70, but now we've seen it even out between all the age groups. This is important because this younger group, the age 20 to 40, also has children in school. So that's another concern about possibly spreading COVID. The schools have been very safe. We've had a few cases in schools, but not all the children in Yarmouth go to Yarmouth schools. And some of the children are at remote learning that had positive cases. You can see that we are now getting cases in the early age between 0 to 10. We've had 14 cases, and between 11 and 20 age group now has 20 cases. The cases overall have ranged between 5 months to age 96. Currently, we're testing approximately 1,200 people a week are getting tested. I will now discuss the color-coded count and rate of positive cases that comes out every Thursday by Department of Public Health based on data from the past 2 weeks. This is why there is a slight difference in the numbers. You can see Yarmouth in yellow with several other Cape towns. Overall, there has been 14,849 total tests, with 2,455 tests over the last 2 weeks. So Yarmouth is averaging approximately 1,200 tests per week. The positivity rate is 4.32%, which is higher than the last week. The health department continues to work on contact tracing and monitoring with the VNA and state contact tracers. So it's important that everyone continues to take COVID precautions. That is by avoiding gatherings, dinner parties, birthday parties, avoiding sleepovers, play dates, whether they're inside or outside. You're meeting somebody at playground with other children. We need to stay away from gatherings. Also, if you don't feel well or are waiting on a COVID test results, please stay home. Don't go to school or work if you have any type of illness. Remember, to stop the spread, mask up, social distance, wash your hands frequently. We all need to take these precautions during this uptick in surge and increases in positive cases. Well, I am now with Jane Kane, Library Director. We're just touching base with the increased surge in COVID in town now that I've just explained. We wanted to take what steps that you're taking with the library, for your staff and the public, for safety. I know you're looking at going back to curbside pickup that we had earlier in the pandemic, and with this new surge, it felt something that after your discussion and meeting with the Board of Health, this would be a reasonable first step to take. So, with that idea, can you just explain how the curbside pickups, how people can order a book or what they would like for a book?
Sure, I'd be happy to, Bruce. We have been open to the public since September 21st during this pandemic, and we tried it out on a gradual basis. We were careful about limiting hours and limiting occupancy in the building. But now, given the way that things are going in town, we have had lots of discussions with town leaders and with Bruce and the Board of Health to determine that it makes more sense at this time that we go back to the curbside environment so that services are like they were in July, August, and into September. It works really easily, and people have really appreciated. Some folks don't even want to come into the building, so they've been really happy that we've been able to provide services virtually and over the phone and on the internet so that folks can get what they're looking for. It's very simple. If folks know what they're looking for, they can call the library and make a request. If it's in our collection, we'll pull it off the shelf, prepare it in a package with the person's name on it, and set up an appointment with those people so that they can pick up what they're looking for. If they're looking for items that are not currently in our collection, they can place holds, or the library staff can place holds for them to reserve items from other libraries that'll go through the interlibrary loan process, get delivered to Yarmouth, get quarantined so that we know that the materials are good and safe for folks to pick up, and we go through the process again. We put the items in a package with the person's name on it, set it outside, set up a time of day for them to come and get it.
Good.
It works great.
And they can still get the same type of books they're looking for, whether it's the new releases or anything. What's available is all on your website?
Sure is. In addition to that, Bruce, a lot of folks have already transitioned over to reading things on their tablets, on their phones, on their home computers. So we can help folks with that, with those type of needs, if they like to read e-content. So that kind of supplements whether or not something's available for them in print right away, or it's something that they can read on their device.
Oh, very good. I know we were able to open up earlier the children's library section, but unfortunately that will have a pause right now. But for people that are still the parents that want to have books just for children, the bundles, they can call you for books and crafts or something?
That's exactly right. Our youth services employees came up with an idea that they would put together kits for different themes or different stories. And now we have available, if folks want to reserve story time, you can just contact our children's staff and they can get items put together for folks to pick up or for folks to watch online.
Good. And we got holiday Christmas books coming now too, or How the Grinch Did, or?
Sure, we have lots of themed books for folks' different interests. We've put together, a lot of our programs have transitioned in the month of December over to virtual programs like the Whoville Express and the Cookie Stroll. Our association put together an idea for a Saturday afternoon event, Saturday, December 12th. Tickets will be available just on that day, and they'll be for sale outdoors.
Right.
And then folks can stroll through the village and have a great holiday experience. The Whoville Express, as I said, has gone online, and they're going to use the opportunity to get kids involved with making artwork and dropping that off at our outdoor pickup area so that they can have their art shared online. We can share it on our website.
So curbside pickup will start when?
Curbside pickup starts tomorrow, December 4th. Friday, December 4th.
Okay, that sounds great.
Actually, you know, we've been doing curbside the whole time.
That's true.
So even when we were open to the public for those amount of between September 21st and now, we still had curbside available, and people take advantage of it all the time, both here at South and at the West Yarmouth Library.
Right. Well, I think that's a great update, and it's great that we're just taking a little pause now during this uptick in surge, trying to keep everybody safe. The library can still get their books, and the staff will still be working, so that's great for the public to know. And I would just tell the people at home to continue to take advantage of the great library opportunities that we have down here and the shows that are coming up. Thank you very much for updating the town.
Oh, it was my pleasure. Thanks for visiting.
Thanks. Thanks for watching. For daily updates on the total number of cases, please visit the town's website. Thank you.